Hi there, I'm Dr. Simon Koss. I'm a registered medical practitioner here in Australia, and I've been in digital health now for about 20 years. At the start of my clinical career, paper was everywhere, and the limited technology that we had didn't help me deliver great quality care. The information in it wasn't complete, it wasn't timely, and it certainly wasn't integrated into my clinical workflow. That realization led me to a career in digital health, and for the first portion of that, I spent time doing what I think we have done as an industry for the last 20 years. I put in hospital information systems, electronic medical records, patient administration systems, what I now call systems of truth. These systems of truth, they're really important. They turn paper into digital, and that has some benefits. It means that for the first time you can read doctors' handwriting, which is a good thing, but it also means that information can be accessed by multiple people in different locations at a single time, something you could never do with a paper medical chart. And once you get comfortable with these systems, you can start to navigate them effectively, putting your hands on information quickly. So there are benefits in digitization. But digitization is not digital transformation. It creates a foundation, and it's what you do next that counts. And this is the era that we're in. This is why I'm so excited about digital health at the moment. The urgency now is shifting from putting in systems of truth. We've largely done that, and we've created lots of data silos. Now the focus needs to be on systems of insight and systems of engagement. Let me take you through what each of these are. Systems of insight is how we take data from all of these data silos, liberate it, bring it together, and use it for secondary purposes. Those secondary purposes might be analysis of the information so that we can see how our performance has changed from this period to the last period and benchmark with our peers. It might be to provide more real-time analysis. So we have a look at what the throughput in our organisation looks like and identify bottlenecks and areas for opportunity and where our patient outcomes are dipping, identifying best practice. Or it might be out into the future being preventative and predictive with artificial intelligence and some more cutting edge technologies that allow us to get in front of some of the bigger challenges in our health system. Systems of insight are important because they generate the insights, but we need to get those insights into the hands of people who can make a difference with them. And this is where systems of engagement come into play. Systems of engagement are how the end users, whether they're patients trying to book their own appointments or self-manage their care, clinicians as they team with other clinicians or go about their rounds delivering patient care, or even administrators and executives as they look at their health enterprises and think about how they grow and how they open new service lines. These people need those insights contextually into the systems that they're using. And if we're able to deliver them in intuitive ways on mobile devices outside the four walls of the hospital, now we've got a flexible, adaptive system of engagement that lets them harness all of the power of the information from those systems of truth, all of the insights generated from secondary analysis through the systems of insight into their workflow. And that's exciting. What does this mean? This means that if we now focus our attention to systems of insight and systems of engagement, we put a flexible and adaptive layer over the top of our rigid health system. We start to bring information together holistically, and we can introduce new models of care in a flexible way. We can spin up things like virtual care, whether that's telemedicine or remote monitoring or looking after chronic disease management out in the community. We can provision population health management and drive the evolution of value-based care. Or we can even usher in the exciting frontier of precision medicine as we learn more about the human genome and more information about the patients that we're caring for. These are exciting times. The promise of digital health, now that we have moved beyond the hard task of digitization into transformation, is really exciting. This is a priority area. This is certainly where governments around the world and companies are focusing their time and investment. And when we make a difference in healthcare, we impact people's lives. I really look forward to what the next frontier of digital health means once we create this adaptive, learning, flexible health system.